In this video, I'm going to go over the internal structure of the heart, and I'm going to start where blood would come in. So this, again, we did the great vessels in another video. This is superior vena cava. This is the opening for the inferior vena cava. This is the right atrium. This structure here is the fossa ovalis. The fossa ovalis is a remnant of an opening between the right and the left atrium. This is the interatrial septum that separates the left and the right atrium. The fossa ovalis would be a remnant of a fetal structure called the foramen ovale. From the right atrium, we're going to go into the right ventricle. This is the right ventricle. This is the right atrioventricular valve, also called the tricuspid valve. The little tendinous cords that are attached to the valve, the cusps of the valve, those are the chordae tendineae, or the tendinous cords, the heartstrings. They are attached to these muscles. These are called papillary muscles. So we have a papillary muscle here, and I'm going to go over to this one here. This is also a papillary muscle that would be attached to the chordae tendineae. One thing also in the ventricles, you have sort of this woven appearance of the muscle. It's called the trabeculae carneae. And then here, this structure here is called the moderator band. It attaches, it would connect the conducting system, the AV bundle branches, to the muscles, the papillary muscles here. But that is the moderator band. Then we have the interventricular septum that separates the right and the left ventricle. Okay, from the right ventricle, you would go into the pulmonary trunk, blood would go to the lungs, and then come back into the left atrium. You can see the opening for one of the pulmonary veins there, and there's probably another opening over here you can see. But this is the left atrium. From here, blood would go into the left ventricle, pass over the bicuspid or the mitral valve or the left AV valve. You can see the chordae tendineae there. And then from there, blood would go into the aorta. Now, I did not mention the pulmonary trunk. I'm going to have to put this back together, or the pulmonary valve. I actually had to put the front of the heart back on so you could, in this particular model, so you could see the pulmonary valve. This would be the valve that goes into the pulmonary trunk. So this would be coming from the right ventricle into the pulmonary trunk. And then this is the aortic valve. So as blood leaves the left ventricle and goes into the aorta, it would have to pass over the aortic valve.